Hi, my name is Andy. I'm this practitioner today. Today I'm going to do a head-to-toe assessment. Can I please have your name and date of birth?
Christy, Journey 6, 2000.
Do you know where you are right now?
Boba Hospital.
Do you know what the president is?
Donald Trump.
Patient is alert already times 4, and speech is clear and deep. So I'm gonna have you remember 3 items: apple, orange, banana. Can you repeat after me?
Apple, orange, banana.
What you had for last night for dinner?
Noodles.
So you're gonna count back from 100 to 50 by intervals of 10.
100, 90, 80, 70, 60, 50.
And what were the 3 items that I told you to remember?
Apple, orange, banana.
Alright, so patient recall is good and normal, oriented times 4. So right now I'm going to do a sensory assessment on you. So you're going to close your eyes and tell me if you feel a painful touch or a light touch.
Painful touch.
Where is it located?
Left arm. Painful touch. Right arm. Painful touch. Left leg.
Mm-hmm.
Painful touch. Right leg.
And this is a painful touch or light touch?
Light touch.
And where is it?
Left arm.
Light touch where?
Right arm. Light touch. Left leg.
Mm-hmm.
Light touch. Right leg.
Okay, so now we're just going to do a sharp or dull assessment. Let me know if this is dull or sharp. Just close your eyes, keep your eyes closed.
Dull.
Well, where's it
Left
located?
arm. Dull. Right arm.
Mm-hmm.
Sharp. Left
Mhm.
leg. Sharp. Right leg.
Okay, that's correct. And then I'm going to ask you to tell me what sensation do you feel?
Vibration.
Mhm.
Left arm. Vibration. Right arm. Right leg. Left leg.
Okay, that's correct. And then you're gonna close your eyes and then you're gonna hold out your arms for me. Like what's my hands? And what object is this?
Marker.
Mm-hmm. And what object is this?
Marker.
Okay, that's correct. And then one more item right here. What object is this?
Cup.
Mm-hmm.
Cup.
Okay, so your focus is intact. So now I'm gonna assess the skin. So inspection, the skin is appropriate for ethnicity. There's no masses, no lesions or breakage. I'm gonna palpate it. Temperature is warm. There's no mass or lesions, no intervention. I'm just gonna elasticity and good mobility. Now I'm going to assess for the head. So on the scale it's atraumatic, non-cephalic. The scalp, there's no masses, no nodules, no lesions. Now I'm going to palpate the scalp. Do you feel any tenderness?
No.
So there's also no masses, no nodules, no lesions. And then I'm going to inspect the face. It's symmetrical. There's no masses. It's no hirsutism, no edema, no masses, no nodules, no lesions. Now I'm going to palpate the hair. It's medium texture and it's well. There's a good quantity and it's well distributed. And then now I'm going to palpate for the temporal artery. So it's 2 plus temporal artery. Do you feel any tenderness on palpation?
No.
Okay, that's perfect. So now I'm just gonna pull out the Rosenberg chart. You're just gonna hold out this chart and then you're gonna read the last line, cover one eye,
Left TFPH.
cover the other eye and read opposite.
HPFTL.
Okay, that's correct. Patient is 2020. So now I'm going to inspect the eyebrows. It's well distributed. There's no mass, no lesions. Eyelids are in the appropriate direction. Eye position is in the appropriate position. There's no mass, no lesions on the lateral and medial canthus. The criminal is, there's no drainage, no redness, and the conjunctiva is pink and moist. Sclera is white, there's no jaundice. Cornea is dome-shaped and transparent, and the iris is brown and well defined. So now I'm going to look at the pupils. It's 3 mm in the right position, and I'm going to assess for the pupil reactions. So you're gonna look at that wall. I'm just gonna shine the light in your eye. Okay, pupil constricts and also constricts in the other eye. So there's concentric response. Going to the other eye, constricts, and one more time. Okay, also constricts in the other eye, so it's concentric response. And now I'm going to actually to fixate to that wall, and then you're gonna switch focus to this pen when I tell you to do so. So look at that wall, and then fix your gaze. So people constrict, so that's within our range. And then for convergence, you're just gonna focus on this pen. So it's converges symmetrically, which is normal, and then you're just gonna cover one eye, and tell me how many fingers I'm holding.
1,
And then cover the other eye.
2.
Okay, so convergence is normal. Now I'm gonna do extraocular movements. I'm just gonna focus on this pen, and I'm gonna do an H position. So extraocular movements are intact. There's no thickness. And now I'm going to assess the eye using my ophthalmoscope. I'm gonna turn off the lights, and 15 feet, I'm gonna open my ophthalmoscope, see that there's red reflux present. Red retinal vessels are normal. Macula is normal, no opacities. Optic disc is normal size. This to cover ratio is 0.3. Now to the other eye, from my left eye to the left eye. Optic disc is normal, macula is normal, no opacities. This to cover ratio is 0.3. Macula is normal, and optic disc is also normal size. And there's no opacities in the other eye. So now moving on to the ear, I'm gonna go behind you, you're gonna occlude one ear. And then you're just gonna repeat after me.
1, 2, 3.
Gonna cover the other eye.
A, B, C.
Okay, so close hearing is intact. Now we're gonna perform the Weber test and the right test. Okay, do you hear the sound in both ears or one ear?
Oh,
Okay, Weber test is from normal range, and right test, I'm just gonna tell me when you, I'm gonna put this tuning fork in the master process, and let me know when the sound stops.
stop.
Do you still hear the sound?
Yeah.
Okay. Do it for the other ear.
Stop. Yes.
Okay, so air conduction is better than home conduction, which is normal. Now I'm going to assess the auricles. So I'm going to assess the auricles, so they're in the appropriate position. They're symmetrical, there's no masses, no nodules, no lesions. And then I'm just going to palpate them. Do you feel any tenderness?
No.
Okay, now I'm going to palpate for the tragus. Any tenderness?
No.
And the master process, any tenderness?
No.
Okay, so that's within normal range. And now I'm going to take a look at your ear. So I'm going to pull the auricle up and back and downward forward my speculum. So I see that the cone of light is at 7 o'clock. The malleus and the pars plana is intact. There's no matches, no lesions, no nodules. Cerium is present. There's no drainage, no edema. Tympanic membrane is fairly gray. There's no scarring or perforation. And then now to the right side. So pulling the auricle up and back. Cerium is present. There's no inflammation, no edema, no inflammation, no drainage. Tympanic membrane is fairly gray and no scarring. Malleus and pars plana is normal. Corneal light is at 5 o'clock. So your ears are in normal range. So now I'm just gonna assess your nose. So you're gonna put one nose and take a deep breath for me. And then put the other nose, take a deep breath. So that's perfect. So it's patent. So now I'm going to close your eyes and I'm gonna hold some items. So what's the smell?
Coffee.
That's correct. And I'm gonna do one more item. Okay, what's the smell?
Tea.
That's correct. So smelling is intact. So now I'm gonna palpate your nose. Do you feel any tenderness?
No.
Okay. So now I'm gonna palpate the frontal sinuses. Any tenderness?
No.
And also the maxillary sinuses. Any tenderness?
No.
Okay. So now I'm gonna take a look at the nose. I'm going to put your nose up. And I'm just gonna take a look. There's no deviation of the septum, there's no masses, no lesions, no nodules, no polypes, no erythema, no inflammation, and there's no drainage. Other nose. So no masses, no nodules, no lesions, no deviation or perforation of the septum, no polyps, no edema. Alright, that's normal. Okay, so now I'm going to move on to your mouth. So looking at the lips, it's nice pink and moist. There's no edema. You're just gonna open your mouth for me. I'm just gonna take a look. I say ah. Okay, so like I said, the lips are pink and moist, no edema. Wait, one more time. Bruno mucosa is pink and moist. You got the tongue, which is also pink and moist. Kind of see under your tongue. Lift your tongue up. It's pink and moist. Looking at the teeth, it's white, and the gums are also. Sorry, the gums are also white. I mean, the gums are also pink and moist. And then I'm just gonna take a look at your tonsils right now. Open your mouth. I'm just gonna take a look at your tonsils. Okay, so tonsils are two plus. There's no mass. There's no exudate, and it's pink, and it's normal size. So that's good. So now looking at the throat. So there's no masses, no lesions, no nodules noted. It's symmetrical. There's no pulsations. Now I'm going to palpate for the lymph nodes. So you got the preauricular. You have the postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, deep cervical chain, posterior cervical chain, and supraclavicular cervical chain. Do you feel any pain or tenderness when I palpate? Okay, perfect. So now looking at I'm gonna palpate the trachea for deviation. Okay, so trachea is, there's no deviation of the trachea, and now I'm just gonna palpate for the thyroid. So I'm gonna go behind you, and then I'm just gonna put my fingers on your thyroid gland, and you're just gonna swallow for me. Okay, perfect. So thyroid is normal size. There's no masses, no nodules, no lesions. And do you feel any tenderness when I palpate for your thyroid?
No.
All right, perfect. Now moving on to the breast. I'm gonna palpate your cervical spine first. Any tenderness here?
No.
Okay, so now moving on to the respiratory. So looking at the chest, there's no protrusion, no bulging, no retraction. A&P diameter is 1 and 2, which is normal. Respiratory rate is also normal. There's regular rhythm, and it's normal. Now I'm going to palpate the back. Do you feel any pain or any tenderness?
No.
Okay, now I'm just gonna ask you to inhale. So chest expansion is normal, and now I'm gonna do tactile pharyngitis. You're gonna say 99 when I place my hand in your back.
99, 99, 99, 99.
So tactile pharyngitis is normal. They're equal bilaterally. There's no consolidation. So now I'm gonna do percussion. So there's resonance throughout the chest, and now I'm going to do diaphragmatic excursion. You're just going to inhale and hold it. Okay, I'll mark the chest after donus, and then you're going to exhale and hold it. I'm going to mark the donus. So diaphragmatic excursion is about 6 centimeters, which is also normal. So now I'm going to osculate for your breath sounds. Oh, where's my stethoscope? Here we go. Okay, so every time my stethoscope is on your back, you're just gonna take a deep breath for me, alright? So breath sounds are normal. There's no adventitious breath sounds. There's no crackles, no wheezings, no rubbing. Now I'm going to do E funny. Every time you hear my stethoscope, you're just gonna say E, okay?
E, 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 E.
Okay, so E funny is normal. They're muffled and no consolidation. Now moving on to whisper vertically, you're just gonna whisper 1, 2, 3 every time the stethoscope hits your back.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1,
Okay, so that's normal, no consolidation, it's muffled throughout and it's not clear. So now moving on to the anterior chest, we're just gonna do the same. I'm just gonna percuss, just let me know if you need tenderness, okay? Need tenderness?
No.
Okay, now I'm gonna do percussion. So there's resonance throughout, which is normal. And now I'm just gonna oscillate for breath sounds. Just take a deep breath. Good sound, let's go. Yes. So it's normal, there's no adventitious breath sounds, there's no crackles, wheezing, or rubbing. So now I'm going to move on to the cardiovascular wise. I'm going to assess your radial pulse. Okay, so after assessing the radial pulse, the pulse is 71. And I'm just gonna measure for the blood pressure. Okay, so when I first hear the heartbeat, that's gonna be the systolic pressure, and when the heartbeat disappears, that's gonna be diastolic. Okay, so blood pressure is 115/60, which is non-intensive. I'm gonna take this off. So now I'm gonna test for pulse deficits. I'm going to listen to the apical pulse, which is in the left mid-clavicular fifth intercostal space. And also I'm gonna feel for the radial pulse. Okay, so there's no pulse deficit, which is normal. And I'm just also going to palpate for the apical pulse. You're just gonna exhale and then hold it. Okay, so apical pulse is palpable. So now I'm going to identify all the 4 landmarks of the cardiovascular wise. So we got the aortic, which is the second intercostal space, right sternum. We got the pulmonic, which is the left intercostal space, second sternum. Aortic, which is the second intercostal space, right sternum. Pulmonic, which is the second intercostal space, left sternum. We got the tricuspid, which is the fourth intercostal space, left sternum, and then we also got the mitral valve, which is the fifth mid-clavicular, fifth intercostal space. So right now I'm just gonna listen to them. So I'm listening for the aortic first, which is second intercostal space, right sternum. Pulmonic, second intercostal space, left sternum. Tricuspid, the fourth intercostal space, left sternum. And we got the mitral valve, which is in the fifth mid-clavicular, left intercostal space. And then I'm gonna listen for murmurs. Okay, so S1 and S2 is present and there's no murmurs found. And then you're just gonna lean forward and I'm gonna listen to the mitral valve again. Okay, perfect. Okay, so S1 and S2 is present and there's no murmur found. And then you're just gonna lay on the bed for me. Okay, perfect. So now I'm going to you're going to turn your head, and then there's no JVD present. Carotid pulse, there's a little bit of pulsation. Now I'm going to palpate the carotid pulse. Carotid pulse is +2, and I'm just going to palpate it. So nice and strong, +2, and I'm going to oscillate it. So it's +2, strong. Now I'm going to palpate the 4 landmarks for any heaves or thrills, any tenderness. Okay, so there's no heaves or thrills felt. Now I'm going to listen to all the landmarks again. Okay, so S1, S2 is present throughout, and there's no murmurs found. And I'm just gonna palpate for your apical pulse again. You're gonna hold your exhalation. Okay. So apical pulse is palpable. So now moving on to the vascular. You can sit back up again. So moving on to the vascular, on inspection, there's no pallor, there's no hair loss, there's no edema. Now I'm going to palpate for the radial pulse. Okay. Okay, perfect. Then the femoral pulse. Okay. Dorsal discretus. Okay, and the distant. And the posterior tibial. Okay. Posterior tibial. So pulses are all +2. And now I'm going to listen to for any buoys. You're just going to lie down, that's all. Just lie down. Like that. So I'm going to listen to the abdominal aorta. The renal arteries. And the femoral arteries. Do it one more time. Okay, so no bruits are heard, which is normal. And now I'm going to assess for the abdominal. So on inspection, there's no protrusion. It's symmetrical. Normal size, there's no synapses, no nodules, no lesions, and there's no abdominal pulsations. So right now I'm going to oscillate the breath sounds with my stethoscope. I'm gonna start from the RLQ and make my way clockwise. Okay, so let me see. Okay, so the vowel sounds are normal active, and now I'm going to do percussion. Okay, percuss. Okay, percussion is stephanic throughout, and I'm going to percuss your liver, marking the area from marking the change of sound to dull. Okay, so liver is about 5 centimeters, and I'm going to palpate for the spleen. It's going to be the mid-axillary 5th left intercostal space. Do it one more time, sorry. Okay, so spleen is about 11 centimeters, which is normal. And now I'm going to do light palpation. Let me know if you feel any pain or tenderness. Any pain or tenderness? Any pain or tenderness? Any pain or tenderness?
No.
I'm sorry, it's like this. Any pain or tenderness?
No.
And I'll do deep palpation. Any pain or tenderness?
No.
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 Okay, so now I'm going to palpate for the liver. Okay, so liver is not palpable, and now I'm going to palpate for the spleen. Okay, spleen is also not palpable, and I'm going to palpate for inguinal nodes. Do you feel any pain or tenderness?
No.
No, okay. So you're gonna sit up, and right now I'm gonna do the CVAC test. I'm gonna look for the coastal vertical angle. I'm gonna straighten my anterior hand. Let me know if you feel any pain or tenderness, alright? Any pain or tenderness?
No.
Any pain or tenderness? No, okay, perfect. So that's within normal range. So now I'm moving on to the musculoskeletal. I'm just going to walk from that wall back to me. Yeah. Not walk all the way. Okay, that's perfect. That's perfect. So it's nice gaits, and looking at the spinal muscles, it's nice and straight. There's no scoliosis noted. Scapular is symmetrical. Now I'm going to palpate the spine. Do you feel any pain or tenderness?
No.
So there's no crepitus noted. I'm going to palpate the paraspinal muscles. Any pain or tenderness?
No.
Okay, perfect. Now we're just going to do some spinal exercises. You just face front again. You're going to move your spine to the left, right, and then you're going to put your hands to your feet, and then you're just going to bend backwards. Okay, so this full range of motion of the spine, and now you could just stand up. And then on inspection, there's no like abnormal movements of the muscles, and there's also they're all symmetrical. So now moving on to the TMJ. I'm just gonna palpate your TMJ. Feel any pain or tenderness?
No.
So there's no masses, lesions, or crepitus. Now I'm gonna do range of motion. You're gonna look up. I'm gonna look up, down, chin to the shoulder, chin to shoulder, ear to shoulder, like here, other ear to shoulder, and then you're just gonna move your jaw side to side. Okay, so that's one range of movement of the TMJ. And then I'm going to assess for resistance for your neck. You're just gonna go against resistance. You're gonna switch your neck to the left, like Swiss neck, and then go to the right. Okay, so the neck can go against resistance, so 5 out of 5 muscle tone and 5 out of 5 muscle strength. So now moving on to the shoulders. I'm gonna palpate for the shoulders, so there's no masses, no lesions, no crepitus, and also palpating for the tendons. So you're just gonna raise your hand up, and then put them all the way to the back, and then put your arms back and put them opposite of the shoulder. Perfect. So there's good internal rotation, and then you're gonna put your arms up and then put them to opposite of the shoulder. So that's good external rotation, so good range of movement of the shoulder. Now I'm going to palpate for the elbow. Any pain or tenderness? No masses, no lesions, no crepitus. Okay, so now you're gonna flex your elbow and then extend them back. So that's full range of motion. And then you're just gonna hold up your arms, and then you're gonna pronate and then supinate. Okay, perfect. Now looking at the wrist, I'm gonna palpate the wrist. Any tenderness?
No.
No, okay. Any tenderness? So there's no crepitus, no mass, no lesions. Now you're gonna do wrist circles for me. And then you're gonna flex your wrist, extend them. Perfect. And then I'm gonna look at your fingers, looking at the proximal interphalangeal and the distal interphalangeal. Any tenderness?
No.
That's the MCP. Any tenderness?
No.
No. Okay. Doing the same for the other hand. Distal MCP. Okay, so there's no masses, no lesion, no crepitus, and now you're just going to do thumb to every finger. Put your thumb to every finger, and you're gonna squeeze, and you're gonna make a wrist. Okay, so 5 out of 5 muscle strength and muscle tone for both the wrist and full range of movement for the wrist and the fingers. Okay, so now I'm going to test for muscle strength and muscle tone for the upper extremity. So you're gonna flex your elbow with resistance, so put them up and extend them down. Perfect. And then you're going to do that with the hands too, like this, with your wrist. Right. Perfect. And down. And then with the fingers. Perfect. And down. And up. Down. So that's 5 out of 5 muscle tone and muscle strength with the upper extremity. And now we're going to palpate the hip. You find any tenderness. So there's no mass, there's no lesions, no crepitus. So I'm just gonna put your feet behind your butt. And then the other one. So that's good extension over there. And now you're gonna lay in the bed and we're gonna do some hip flexion. Perfect. Okay, so you're gonna put your thighs up to your chest and then the same one for the other leg. And then put them straight. So that's good range of motion of the hip. Now you're going to put your legs out. So that's AB deduction, adduction. And then I'm going to perform rotation. External and then internal. External, internal. So that's one range of motion of the hip. Now I'm just gonna assess for muscle strength and muscle tone. So you go against you're gonna do flex your hip one time. Do it to the other leg. And then go back down, go back up, down. Right, perfect. Now you can sit up. Okay, so I'm gonna palpate your knees. Do you feel any tenderness? So no mass, no lesions, no crepitus, any tenderness?
No.
Okay, so you're just gonna keep your legs straight. And then the other one. It's a good extension, and then you're going to put it all the way back now. Yeah, perfect. So that's good flexion and extension. And now with the resistance. And then, okay, 5 out of 5 muscle tone and muscle strength. And now I'm gonna palpate the ankles. And then ankles. Any pain, tenderness, any of that. So there's no crepitus, no massive lesion. And you're gonna do ankle circles for me. Another one. And you're gonna do heel inward and heel outward. Okay, perfect. So now I'm going to. So that's full range of motion of the ankle, and now I'm going to palpate for the feet with the proximal and the proximal, distal, and the MCP. And the other one. Proximal, distal, and the MCP. Okay, so that's within the range, and then you're just gonna put your feet up. You're gonna flex. You're gonna dorsiflex up, and then plantarflex down, and the other leg. Dorsiflexion, and then up, plantarflexion down. And then you do it with resistance. Okay, that's perfect. 5 out of 5 muscle tone and muscle strength for both upper extremity and lower extremity. And now we're going to do the pronator drift. You're just gonna stand up, and then you're going to hold your palms up. Stand up, hold your palms up, and close your eyes. You're gonna go like this. Yeah, keep your arms straight, and then close your eyes, and then you're gonna wait for 15 seconds. Okay, so there's no unilateral drift. There's good balance, and now you're just gonna close your eyes, and then keep your arms straight, your hands down, and you're gonna wait for 15 seconds again. Okay, so there's no unilateral, there's no drifting, arms are straight, so that's within normal range. Arm vertex and the pronator drift is normal. So now you're gonna walk heel to toe across that room and back to me. Okay, so that's good balance. There's no drifting. Gait is steady, and then you're going to heel, walk on your heels to that room to me, across the room to me. Okay, so that's good balance. There's no swing. Now you're gonna sit down and do shin to shin. Put your leg like shin. That's your other leg. And then do the same for the other one. So that's good balance there. And next, I'm just going to ask you to touch your nose and put your finger from your nose to my finger. Like, yeah. Okay, so that's good balance. Let's see, let me see. Okay, so now we're going to assess for the cranial nerves. Cranial nerve number 1, which is olfactory. She was able to identify the correct smell with the item. And then we got cranial number 2, which is optic. She was 20/20 vision, so that's intact. Cranial nerve number 3, which is trochlear. Her pupils, cranial nerve number 3, which is ocular movement. Her pupils were able to constrict. Cranial nerve number 4 and 6, her extraocular movements were intact, so that's normal. Cranial nerve number 5, trigeminal. You're just gonna clench your teeth for me, and then I'm gonna use some resistance and go against that. Okay, so she's able to go against resistance, so that's intact. You're just gonna close your eyes and tell me where you feel the sensation at. Which side?
Left cheek.
And which side?
Right cheek. Forehead.
Okay, so trigeminal number 5 sensory is intact. Cranial number 7, which is facial. You're just gonna smile for me, and then raise your forehead, and then blow some. Raise your eyebrows, and then blow some air into. Okay, so that's normal. Cranial number 8, which is vestibular. She was able to. She had a normal Ryan test and a Weber test, so that's normal. Cranial nerve number 9 and 10. I'm gonna test for that right now. I'm gonna test for your gag reflex and the uvula. Take it over your mouth, and I'm gonna test for your gag reflex. Okay, so this gag reflex, and then I'm gonna look at the uvula. So uvula is in the midline, so 9 and 10 is intact. So cranial number 11, which is fine accessories. I'm gonna put some resistance on your shoulder, and you're just gonna shrug against resistance. So she's able to shrug against resistance, which is normal. And cranial number 12, I'm gonna ask you to stick your tongue out, move them side to side, and then up and down, and then say la 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 la. Okay, so that's intact. So all the cranial nerves are intact and normal. So now moving on to the deep tendon reflex. I'm going to do the knee. Oh wait, I'm going to do the bicep first, sorry. Okay, now the tricep. Okay, 2 plus 2 plus, and the other arm. Alright. Okay, 2 plus. And now I'm going to do the brachioradius. Okay, that's 2 plus. Okay, so now I'm gonna do the quadratus patellar. It's gonna be under the kneecap. Okay, now the other one. Okay, that's 2 plus. Now we're gonna do a child's ankle, which is gonna be behind the ankle. And the other one. So they're both 2 plus, and I'm just gonna do Babinski reflex. I'm just gonna scratch against the soles of your feet and see if there's like a C position. Okay. Okay, so there's Babinski reflex. There's a C position. This reaction, so that's within normal range. So that concludes our head to toe assessment. All the findings were normal. I'm just going to leave the room so you can get dressed.